So you have reached a point where I would recommend knee replacement to you. But you need to understand some aspects about knee replacement to fully absorb what that means and what it entails. And knee replacement is one of the more successful operations you can be offered. It's not quite as successful as hip replacement, but 80% of patients who have a knee replacement are happy with it and are glad they had it done. It's a small enough group of those, however, that would say it's excellent and they forget they had it done. That's maybe only 10%. Whereas for hip replacement, you'll have figures of something like 60 or 70% of patients who would feel it's excellent. So it's important to understand that there's a difference between those two operations, despite what you might hear. So if I was to take 100 patients who have a knee replacement, probably 80 of them would be happy they had it done and would consider having the other side done without hesitation. Another 10% or 10 patients out of that 100 would say it's okay. It didn't do everything they wanted, the knee isn't perfect, they're aware it's there, it's not their own, it's a little bit tender and sore, but it's better than it was, it's not progressively deteriorating, and by and large, they would regard it as successful. And then there's another 10%, unfortunately, that would have regrets about having had it done for a variety of reasons. Sometimes it's something obvious, like they got a complication, and there are a long list of things that can go wrong with knee replacement, none of which are common, but put together, they add up to maybe half of that 10% that would say, I regret having had it done. And then, unfortunately, there is a small cohort of patients where nothing went wrong per se. The x-ray looks good, the knee is bending freely, it's not stiff, there was no complications, but it's just not suiting them at all, and it's sore and painful, and they are a challenging group of patients, and it's because of that group of patients that we are slow to offer knee replacement before it's a last resort, because we can't predict who's going to end up in that dissatisfied group. But having said all that, 80% of patients are really happy with the operation. If it's done in somebody who has truly reached the end of the road, both clinically and on x-ray, with bone scraping off bone, that group is significantly higher. But if you take all comers having knee replacements, unfortunately there's about a 1 in 5 chance there'll be some degree of disappointment afterwards.